With only 5% of the world's population, the United States holds 25% of its prisoners. Out of the 2.3 million people that are incarcerated in America, nearly 30,000 are HIV positive, which is equal to approximately 1.4%.
During the 1980s, President Reagan used the war on drugs as a way to combat social problems of the time and earn popularity with the public. Since then, we have seen a dramatic increase in the prison population due to stricter laws and punishments regarding drug crime. The U.S. rate of incarceration has risen to 750 inmates per 100,000 residents, which represents a 500% increase over the past 30 years.
Factors such as drug addiction, poverty, substandard nutrition, poor housing, and homelessness are social determinants that yield an increased risk of HIV, but are also linked to lifestyles of those targeted by the war on drugs, so it's not surprising that we see such a correlation between infection and incarceration.
1.1 million people in America are HIV positive. Each year, 1 in 7 persons living with HIV pass through a correctional facility. The rate of HIV cases among state and federal prisons is 2.4 times greater than that of the general population. By the early 1990s, 2/3 of all deaths of incarcerated persons in New York were AIDS-related.
One can observe every type of risk for HIV transmission in the prison system. There is unprotected sex, the sharing of drugs or piercing equipment, and a lack of infection control services for mothers with infants.
As a result of the war on drugs, a high number of those imprisoned are drug users, many of whom use intravenous methods. With a higher number of injecting drug users, there are higher risks of HIV transmission within prisons. Due to the environment of the prison, most prisoners use unsanitary needles and share them among other inmates.
Another means of HIV transmission in prisons is unprotected sexual intercourse. Some factors that contribute to this are the unavailability of condoms and high rates of rape within prisons. Although tattooing is illegal in most correctional facilities, it is still common amongst incarcerated people. This involves multiple skin punctures by recycled needles carrying ink as an unsterile environment, leading to the transmission of HIV. Poor prison conditions such as overcrowding, a shortage of clean water, inadequate natural lighting and ventilation, and poor facilities for personal hygiene can also worsen the situation for those who are suffering from illness. So clearly there is a strong correlation between incarceration and the contraction and spread of HIV, but luckily others are increasingly aware of this. Shortly after Reagan's increase in incarceration, people began noticing the negative effects on public health and spoke up. In the late 1980s, ACT UP, an advocacy group for the rights of HIV-infected individuals, began a campaign through various forms of protest and civil disobedience to push the topic of AIDS and the treatment of HIV-positive prisoners into the public eye, especially regarding segregation of those infected with the disease.
Especially during the 80s and 90s, prisons segregated the HIV-positive inmates from others. This was problematic because segregated prisoners were often excluded from many of the rehabilitative and vocational programs that were offered to other prisoners, and it was also seen as an unnecessary form of discrimination against an already stigmatized population. Today, the prisons in the United States have stopped that practice, but certain states, such as South Carolina, held on to these discriminatory measures until very recently.
Following the work of ACT UP, in the 1990s, leaders of PWA, People with AIDS, made further effort to speak up regarding awareness of HIV in the United States by holding marches, forums, and other methods of grabbing the attention of politicians and the public at large. In a tragic but powerful form of action, Michael Van Straten, a PWA prisoner, committed suicide to protest the conditions and treatment of HIV-positive prisoners.
Along with the changes made in South Carolina in 2012, when they became the last state to finally outlaw the use of segregation of inmates based on HIV infection, other correctional facilities have been hearing the cries of protest and are starting to make changes. For example, jails in Chicago agreed to alter their policies regarding medical care and privacy for HIV-positive prisoners, as well as a mandatory training of jail staff in HIV education and the necessity of ensuring access to proper medication.
While these steps are obviously important, we still have a long way to go in the fight for the rights of U.S. prisoners, especially those infected with HIV and other diseases. It is important to get these statistics out, to spread the word, and to help provide a voice for those who cannot get their own word out.